Chapter 8 Allied Health Professionals. Exercise 8.1 Make word combinations using a word from each box. Look at A, B, C, and D opposite to help you. Ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Which allied health professionals could best help the following people? Look at A, B, C, and D opposite to help you. It is the exercise 8.2. Number 1. A young unmarried woman. A young again. Number 1. A young unmarried woman who has just had a baby social worker. Number 2. A woman who is having difficulty using her right arm following a fracture. Therapist orthosis. Number 3. Someone who needs glasses. Opticians. Number 4. An elderly woman who has had a below knee amputation. Prosthetics and orthotics. Prosthetics and orthotics. Number 5. A woman whose wife has Alzheimer's disease. A man whose wife has Alzheimer's disease. Occupational therapist. Number 6. A man with a fungal infection of his feet. Podiatrist. Exercise 8.3 Complete the test. Look at A and C opposite to help you. A prosthetist works with patients of all age as a member of a clinical team based at a large hospital. The patients may need a prosthesis as the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without limb. Orthotists work alongside doctors, um, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages, for instance, children who have cerebral palsy may require rehabilitation to help them walk, and any older people need special shoes to correct deformity. If damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Chapter 9 Hospitals. Exercise 9.1 Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verbs noun. Admit, admission, access, assessment, discharge, discharge. Operate, operation. Refer, reference. Treat, treatment. Exercise 9.2. Make word combinations using a word from each box. Look at C opposite to help you. Acutely, acutely ill. Assessment unit. On duty. Referral letter. Waiting list. Exercise 9.3. Which hospital department will be most appropriate for the following patients? Look at A, B, and C opposite to help you. Number 1, a woman and diabetic coma, intensive care unit. Number 2, a patient who has just had a radical prostatectomy, surgical high dependency. Number 3, a patient who is to have a skin lesion removed, day surgery unit. Number 4, a man with a foreign body in his eye, accident and emergency department. Number 5, a woman with a threatened abortion, maternity emergency. Exercise 9.4. Complete the extract from an information reflect for patients. Look at A, B, and C opposite to help you. Information for adult patients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an X-ray, which could mean going to another department, or you may be referred to other professionals, such as a physiotherapist or dietitian. You have need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to if you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Chapter 10. Primary Care. Exercise 10.1. Complete the sentences. Look at A opposite to help you. Number 1. Children over 60s and people with some chronic disease do not have to pay prescription insurance in the UK. Number 2. Patients with mobility problems may be unable to go out. They are housebound. Number 3. The average GP appointment is 10 minutes long. Number 4. A locum is someone who takes the place of a staff member who is on leave. Number 5. Care outside working hours is known as home visit request treatment. request treatment. Number 10.2, exercise 10.2, make word combinations using a word phrase from each box. One word can be used twice. Look at A and B opposite to help you. Change dressing. Make appointments or home visits. Um, Perform minor surgery. Refer a patient. Run a clinic. Supervise staff. Take take matches. Take matches. Exercise 10.3. Which member of a practice team would be responsible for each of the following? Look at B opposite to help you. Number 1. Running a clinic for pregnant women, midwife. Number 2. Teaching a patient how to straighten his broken leg, physiotherapist. Number 3. Letting to GP know that a patient can't come to her appointment, receptionist. Number 4. Running a clinic for people who want to lose weight, lose weight, practice nurse. Number 5. Visiting a patient who has just returned home after a hernia operation, district nurse. Number 6. Carrying out checkups on children in a poor neighborhood, health visitor. Number 7. Organizing cover for an absent doctor, practice manager. Number 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. 1 and 2 p.m. Practice 10 meeting over sandwich lunch. 2 or 4 p.m. Afternoon surgery. 12 10 minutes appointments. 4 and 4:20 p.m. coffee break. 4:20 at 5 p.m. check with reception for messages, deal with home visits and repeat prescriptions request. 5 and 6 p.m. paperwork, referrals to secondary care, admin task, telephone call to patients, private medical examinations. 6 o'clock p.m. forms wished to OOH service.